Did you know that artificial lens implanted during cataract surgery can do more than just make your vision clear again? It can be tailored to your lifestyle. If you're facing cataract surgery and feel overwhelmed by the lens options, you're not alone. Stay tuned as I'm going to break down how to choose the best lens for your eyes in simple terms. Hi, my name is Dr. John Legarreta. I'm a board-certified ophthalmologist and cataract surgeon. I've helped many patients navigate cataract surgery, and one of the biggest questions is always this: which lens implant should I choose? In today's video, I'm going to guide you through the basics. No jargon, just clear, empathetic explanations so you can approach your cataract procedure with confidence and peace of mind. Cataract surgery itself is straightforward. We remove the cloudy lens, the cataract, and replace it with a new clear intraocular lens, IOL, inside your eye. The exciting part is that you have options for the type of lens implant that we put in your eye. Choosing the right one can make a big difference in your post-surgery vision. It's essential to discuss these options with your eye surgeon before you have surgery. But I first want to get you familiar with what the lens options are. Generally speaking, we talk about three main types of lenses that are available for cataract surgery, and each has its pros and cons. Number one are monofocal lenses. This is the standard lens that gives clear focus at one set distance, usually far away. It's tried and true and usually covered by insurance, including Medicare, making it a very popular choice. But what's the catch? You'll likely need glasses for other ranges, especially for reading and computer work. And if you have astigmatism, you'll probably need glasses for distance as well. Monofocals provide excellent quality vision at their focus distance, but won't give you both great far and near vision at the same time. The next lens is a toric lens, or what we know as an astigmatism-correcting monofocal lens. Do you have astigmatism, a cornea that's misshapen in one axis compared to the other? A toric lens is essentially a monofocal with astigmatism correction built in. It can sharpen your vision by correcting astigmatism during cataract surgery. Toric IOLs typically focus at one distance like a monofocal, so you may need glasses for near tasks, but you won't need separate glasses for astigmatism, and correcting glasses for clear vision at your chew. A toric lens is put in for distance vision, and you wear glasses for reading up close, but you typically do not need glasses for seeing things far away. If you have a significant amount of astigmatism, this lens can give you clearer vision than a regular monofocal would. And the third option is what we call a multifocal or advanced multifocal lens. This is a premium lens designed to provide a range of vision for multiple distances: far away vision, intermediate, and near focus, all in one lens. The goal here is to reduce your dependence on glasses as much as possible. But remember, it's reduce, not necessarily eliminate. Many patients with multifocal lenses find they can drive, use the computer, and read a book with much less need for eyewear. But this sounds amazing, right? But there are trade-offs. These lenses are often an out-of-pocket upgrade. They're usually not covered by basic insurance. And as a side note, the toric lenses are also an out-of-pocket upgrade as well. And because the multifocal lenses are built in a certain way, you may notice some glare or halos around lights at night. For example, driving after dark, street lights might have a slight ring or glare to them. Most people can adapt to this, but if you're very sensitive to glare, it's something to consider and maybe avoid. During daytime, vision is generally very good, but contrast sensitivity, and this is the sharpness distinction between light and dark, can be a bit lower than a traditional monofocal. So in short, multifocal IOLs offer the convenience of less glasses use with some possible visual side effects. So you have to remember there's no one best lens for everyone. Each type has its advantages, and it really depends on your eyes as well as your lifestyle. In the next section, I'm going to go through 10 key questions that will help you figure out which lens might be the perfect fit. Before we do that, you might be asking, well, what about monovision? You didn't mention anything about that. And aside from the lenses types above, you might hear about monovision as an additional approach. Monovision means using a lens in one eye set for distance and the other eye set for near. The brain then blends the vision together to give you an overall range. This isn't a specific lens though, but rather a strategy using 2 monofocals or a toric lens, depending on your astigmatism. If you ever worn contact lenses with one for reading and one for distance and liked it, then you're likely a good candidate for monovision in cataract surgery. It can reduce your need for reading glasses without the specialized multifocal lens. However, monovision can take some time getting used to, and not everyone loves it. It's best for those who've tried it before successfully. If you haven't, don't worry. Your doctor can help simulate it for you and decide if it's right for you. Now, on to the 10 essential questions you should ask yourself before choosing a lens. And choosing a lens becomes much easier when you consider your own daily life, your eyes, as well as your priorities. And to guide you, here are 10 questions you should always ask yourself before picking a lens for cataract surgery. You might even want to grab a pen and jot down your answers or thoughts for each of these. And I've grouped them into categories to make it a little bit easier. So the first category is lifestyle and vision goals. Think about what you do every day and what you want from your vision. Number 1, what are my daily activities and visual priorities? Consider how you spend most of your time. Do you love reading or doing close-up crafts? Or do you drive and enjoy outdoor activities like golfing? Make a mental list. Reading, computer, driving, night driving, sports, hobbies. If you spend hours on the computer or reading, having good near or intermediate vision after surgery may be high on your list. On the other hand, if you're an avid driver, especially at night, or you enjoy birdwatching, tennis, or pickleball, distance vision clarity will be a top priority. Knowing your top activities will help you align with the lens that best suits those needs. Number 2, how important is it for me to minimize the use of glasses after surgery? Be honest with yourself. Would it bother you to still wear reading glasses for small print, or are you okay with it as long as your distance vision is sharp? Some people absolutely hate glasses and misplacing their readers. Others don't mind slipping on a pair for fine print. If you crave as much glasses-free time as possible, for example, you want to wake up and read your phone without reaching for specs, you might lean toward a multifocal lens. If you don't mind glasses for certain tasks, a monofocal lens with glasses as needed could be perfectly fine. Think about your convenience versus clarity versus preference here. The next category is eye health and history. These are factors about your eyes that can influence the best choice. So number 3, do I have astigmatism in my eyes? Astigmatism is a common condition where the eye isn't perfectly round, leading to blurred vision. Your eye doctor can tell you if you have significant astigmatism. Well, why does this matter? Well, if you do, a toric lens may give you much sharper vision by correcting it. If your astigmatism is minor, a regular lens plus a small eyeglass prescription might handle it. But if it's moderate to high, you'll want to address it. Ask yourself if you've been told you have astigmatism, maybe from past glasses prescriptions, and correcting astigmatism during cataract surgery can free you from having to wear glasses just to fix the blur from that condition. So knowing this helps guide the choice versus toric versus a non-toric lens. Number 4, have I had success with monovision or similar setups before? This refers to using one eye for distance and the other for near, often tried with contact lenses. If you've tried this in the past with contacts or sometimes with LASIK and found you could function well, that's a clue you might do well in choosing monovision now for your vision after cataract surgery. If you've never tried it or you didn't like it, maybe it made you feel off balance or affected your depth perception, then you might favor other solutions like a multifocal lens or just using glasses for reading after cataract surgery. This question is really about your personal experience. Those who know they adapt well to monovision often consider it, and those who don't, skip it. It's perfectly okay, whatever camp you are in. Just important to note before deciding. Number 5, do I have any other eye conditions that could impact my lens choice? Well, besides cataracts, is there anything else going on with your eyes? For instance, macular degeneration, significant glaucoma, diabetic retinopathy, or corneal problems. These conditions can affect how well certain lenses work for you. For example, a multifocal lens relies on a healthy retina to give good results. If you have macular degeneration, a multifocal lens might not provide you with the benefit you hope for. Additionally, conditions like severe dry eye or past eye surgeries could influence outcomes. Take stock of your overall eye health, and your ophthalmologist can help with this. If you do have other eye issues, you might want to lean towards a more conservative lens choice that maximizes quality of vision since your eyes already have challenges. So this question really ensures that you're factoring in the whole picture of your eye health when choosing your lenses. Next topic area, preferences and expectations, your personal comfort and what you should expect after surgery. So number 6, how sensitive am I to glare or halos around lights? Think about night driving or walking into bright sunlight. Do bright lights bother you a lot? Some people are pretty easygoing with visual imperfections. Others find glare and halos super annoying or even unsettling. This matters because, as I've mentioned before, premium multifocal lenses can introduce more halos or glare, especially at night. So, if you know you're already sensitive to bright headlights or halos, or you absolutely must have crystal clear night vision for, say, driving trucks or frequent travel at night, you really might favor a monofocal or toric lens to keep things simple and your vision sharp. But if you think a bit of halo or glare won't bother you, or you rarely drive at night, then a multifocal could be a wonderful trade-off for the daytime convenience of not needing glasses. But you need to be true to yourself on this. It's about your tolerance for visual side effects. Number 7, am I willing to accept some trade-offs to achieve my vision goals? In life and eye surgery, there's rarely a have-it-all solution. Each lens option may involve a compromise. For example, choosing a monofocal lens means you'll typically have good vision at one distance, but you'll trade off the convenience of seeing at other distances without glasses. Choosing a multifocal lens might give you the range of vision you need, but you have to trade off a bit for sharpness or halos and glare. So ask yourself, which trade-off would bother me less? Needing reading glasses or seeing halos? Absolute clarity at one distance or a little softness but more range? If you have a strong preference, like I never want to wear glasses again, or conversely, I never want halos, that will guide your choice. It's important to mentally prepare that no single lens is perfect, and being willing to compromise on certain aspects of your vision will help you feel more satisfied with whatever lens you do get, because you will go in with realistic expectations. Number 8, will I be patient adjusting to a new type of vision if needed? Adapting to a new lens can sometimes take a little time. For instance, if you go with monovision or a multifocal lens, your brain might need days, weeks, or even months to fully adjust to the new visual system. During that time, you might notice things are weird or not immediately perfect. Are you the kind of person who can stay calm and patient during this adjustment period? If you know you get anxious when your vision isn't immediately 100% perfect, you might lean toward a simpler solution, like both eyes with distance vision with a monofocal, and then use glasses for near, which typically has a quicker, more predictable adjustment period. But if you're okay with a short learning curve for your eyes and brain, then you could handle a more complex option potentially. Essentially, patience is key for advanced lenses. Ask if you're ready for that or if you prefer immediate simplicity. In the final topic area are practical considerations, real-world factors in making your decision. Number 9, is cost a factor for me in this decision? It's an uncomfortable question, but an important one. Basic monofocal lenses are usually fully covered by insurance and Medicare. Toric and multifocal lenses often have additional costs since they're considered upgrades. If you have the budget and view it as an investment in your vision, you might be open to premium lenses. But if paying out of pocket would be a burden or a source of stress, there is no shame in choosing the high-quality monofocal option that insurance covers. The key here to remember is that your eyesight will improve with cataract surgery because the cataract is being removed. And so regardless of what lens option you pick, you're still going to have visual improvement. So you need to be honest about what makes sense for you financially. The last thing you want is to feel pressured in your lens option. There are excellent options at all price points. The goal is the best outcome for you within your means. And number 10, have I discussed my goals and concerns thoroughly with my eye surgeon? After you've thought about all the questions above, the final step is making sure to communicate all these priorities to your surgeon. Ask yourself if you've shared what's most important to you. Do they know you love to read for hours? Have you told them you're nervous about night driving glare? Make sure you've asked all your questions too. For example, which lens would you choose if it were your eye doctor and why? Ultimately, lens selection is a decision you and your ophthalmologist should make together. Your doctor will have measurements and medical insights and bring your lifestyle and preferences to the discussion. When you've had a good two-way conversation, you'll feel much more confident that the choice, whether it's a basic monofocal or a fancy multifocal, is the right one for you. So if you haven't already, set up that chat and go over the list of questions. Your doctor is there to help you make an informed decision. So making the right choice can sound daunting, but remember, this is an opportunity to customize your vision to fit you. By considering your lifestyle, your eyes, and your personal preferences, you're already on the right track. The good news is that there's likely a great option for everyone. It's just about finding the perfect fit. And you're not alone on this journey. Your eye doctor is there with you. And for those people in Western New York and the Buffalo area at Legarreta Eye Center, we're here to guide you. If you or a loved one is preparing for cataract surgery and still has questions, reach out to us. You can schedule a consultation with me, Dr. John Legarreta, or our team, and we'll walk you through all your options one-on-one. Our goal is to make sure you feel comfortable, informed, and excited about your vision after cataract surgery. So imagine waking up with your vision and knowing you made the right choice. That's what we want for you. So don't hesitate the next step. Give your surgeon a call. Give us a call. Visit our website to set up your cataract evaluation. Together with your surgeon, you'll ensure you achieve the best possible vision and get you back to enjoying life with clear sight. Thank you for watching. I hope you found this video helpful. If you did, feel free to like and share this video with others considering cataract surgery. And remember, when it comes to your eyes, there's always an option that's right for you. Take care and see you next time.